Dr. Nadia, in your presentation we saw a lot of periimplantitis cases.
Yes.
And do you think that nowadays in implant therapy this is a really big problem, periimplantitis, or it's just a marginal problem? What's your point of view?
I think it's a veritable problem. It's not a huge problem, but it can reach up to 20%, as we know from the literature. So I think it's really a problem we have to take seriously. And it's a condition of implants that we have to detect at an early stage in order to get it under control. Yeah.
So how to avoid periimplantitis?
That is a really good question. I hope I could answer. I think there is different factors that have to come into consideration when reconstructing with implants. Mainly I think it's that the tissues are healthy, that you have a periodontal maintenance of the patient before you place implant. And then also from evidence we know that the regular maintenance phase is really important for implants. It will probably not prevent from still having some periimplantitis cases, but the future will hopefully tell us more regarding this question.
So answering shortly, good surgery, good prosto and good maintenance.
Yes.
Thank you very much.
Thank you so much.
Dr. Miller, we saw a lot of cases in your presentation with the periimplantitis and implant treatment complications. And do you think that the laser therapy is the best therapy for the patient with the problems like this?
Well, let me begin by saying this. We are leaving the era of mechanical manipulation of tissue behind and entering the era of biologics. And when we talk about lasers, laser is not just a physical instrument to physically clean the surface of the implant. It's also a biologic. And when we treat the surface of an implant, we're doing that to remove pathology from that. But when we're removing pathology from the bone and the soft tissue, it's also a biologic because it affects a change in the way tissues heal. So we want to talk about instrumentation and new instrumentation. The laser is a superior instrument, not just to debride and surgically clean and decontaminate the implant surface, but also change the way tissue heals.
So do you think that the laser is going to be the new gold standard in periimplantitis treatment?
Well, understand the word gold standard, because gold standard constantly changes. And if we look back at grafting procedures, perhaps autogenous bone was the gold standard for decades. Today we have alternatives to that. We do have alternatives now to the physical instruments that we had, what I call cold surgical steel. And the laser energy that gets used to debride an implant surface does a superior job to manual instrumentation and will effect a change in terms of the way tissue heals. So for me, lasers are an added benefit and not just another instrument.
Thank you very much.
Thank you.
Dr. Meyerberg, we had a great lecture. We saw a lot of examples with the implant that failed. And from your experience, what is your advice to me? I don't want to lose my implant. What is your advice? How to do that?
First of all, thank you very much for this very kind invitation. It was a great pleasure to share my time actually with so many nice and also competent people. The question, of course, is also very competent because this is what every patient asks me every day. So I don't tell you what I tell the patient, I tell you what I believe, and more it turns out that the operator is the greatest risk. So I would advise all the operators don't take too many risks. So do only one miracle at a time. This means, for example, small steps. First augment if there's a lot of tissue missing, and then place the implant. Don't load the implants too early. And second thing, before you do anything, any intervention, check with your list risk factors as smoking, bruxism, incapability for the patient to clean well enough, so you can adapt your concept and sometimes come to the conclusion that maybe it's better not to place an implant and look for alternatives.
Perfect. And how to avoid peri-implant tissue infection?
Probably nowadays the most important question. It's also complex. I would say 3 factors. First of all, proper placement of the implant, perfect position. That means you can clean it easily, the patient and you too as a clinician. Second thing is, don't go for risky construction of the implant in terms of rough surfaces in the soft tissue, or difficult to clean conscious wide platform switches which are difficult to clean. And certainly the third factor is smoking. This is actually the one and maybe most important factor we have and which we can also control. And I would rather send the patient home from the office when I see he will not be able to refrain from smoking or is not interested in maintaining a good oral hygiene. So oral hygiene plus lack of negative environmental factors like smoking are probably the most important factors, apart from the implant design, surface issues, construction of the prosthesis.
Perfect. Thank you very much.
You're welcome.
Dr. Khan, in your presentation we saw a lot of great surgeries as well as great prosthetic reconstructions. So when we want to be successful in an implant treatment, you think the surgery is more important or the prostate is more important?
You know that my opinion is that both sides are very important. The best solution is that you as a surgeon know the problems with prosto. Because if you know the problems with prosto, then you will be a better surgeon. And on the other way around, you'll be a better prosto guy when you know the problems of the surgeon. So that's why I did both sides, and I like to do both sides, because I think then you are more successful when you are trying to be on both sides.
Thank you very much. And the second question is, we can use long implant, we can use short implant, but as we know, the most important thing in the implantology is the transition zone.
Yeah.
What is your opinion about the transition zone?
Yeah, I told colleagues even 15 years ago that is the important zone, because if you are very correct, then it will be hell. And if you do mistakes there, then then it will be heaven, and you will get your visions come true. But if you do mistakes there in the transitional zone, or sometimes I call it the interface in between prosto and surgery, if you do mistakes, then it will be hell. It will be like fire. That's for me the most important part, that from both sides, from the surgery and from the prosto side, you have to really focus this area. It's the most important at all.
Thank you very much.
You're welcome.